This is made possible by our partners, Solar Dynamics, the most efficient energy systems.
Good evening and welcome to The People's Business. I'm Wendy Burke. First of all, let me apologize for the late start of our programming. We've been having a myriad of technical issues this evening. Apparently Murphy's Law has been well at place. However, it's time to change the lawmaker, and it's now Wendy Burke in the chair with The People's Business. And we will be dealing with mental health, the COVID impact. To help me, I have a number of guests this evening who are on with us. First off, we have ORCHID JESSAMY, who is a registered nurse and a nurse lead at the Queen's College Isolation Center. Good evening to you, ORCHID. Next up is KADISHA DOUGLIN, a member of the BARBADOS Association of Psychiatrists. Then there's Miss FELICIA GILL. She's the Isolation Facilities Clinical Psychologist. And also Beverley Marshall, a COVID-19 survivor who's joining us from the UK. We want to thank you for staying up beyond your bedtime to be here with us this evening, Miss Marshall. Well, that's our guest. As we said, mental health, the COVID impact. We'll be back in a moment. And we're back with The People's Business for Sunday, October 3rd. First off, I will go to Miss Marshall, who happens to be a survivor of COVID-19. Not only is she a survivor, but she has unfortunately also loved some near and dear to her who have died of COVID-19. Ms. Marshall, tell us what you've been through thus far.
Well, I don't know if you'll remember, I contracted COVID the early part, when everything first started happening. That was last March. And it was a time when you didn't know what was going on. You didn't know, or you knew that people were dying from it. So it wasn't only myself that got COVID, it was my mother also, my brother, my aunt, and two close family friends who I never mentioned before. And subsequently, I literally saw him die in front of me. We saw when he deteriorated, and we saw when they took him away to Enmore, and we never saw him again. A couple of days after that, he was gone.
And how was that on you mentally and emotionally? And was there anyone to help you cope?
I'm not sure if I'm allowed to mention her name, but there was a psychiatrist that was assigned to Paragon, and she got me through a lot. I relied on her a lot. There were times, especially when I came home, and the isolation was still there when I came home, because I came home and left my parents, my mother, my brother, and my aunt. And to be quite honest, they're all the family I have back home. My family's really here in the UK. So leaving my mum there and coming home to an empty house, that felt abandoned, because we literally had to pack up and just leave. They came, we found out one day, we were gone the next. And the hostility from the neighbours, I don't blame anyone, because they didn't know. At that time, there was little known about this coronavirus, COVID, it was killing people of my demographics and my mother's. We were old. Well, I'm in my 50s. My mum's in her 70s. So you just didn't know. And I did have symptoms of COVID. I was ill. I did have the pain and the fever, and I was scared. It was a very scary time. You didn't know. You just didn't know. And I think it's the not knowing that when I was in Paragon, it was the not knowing what was going to happen. Then when I got my negative and I was able to come home, it was the isolation when I got home. I got home, my mother was not with me, and it's just me and my mom, and she was there for a long time. So, you know, Dr. Drummond, she got me through everything. I wouldn't have made it without her. I wouldn't
Okay.
have.
If we can speak now to the two who work at the isolation facilities. Miss Marshall managed to get through her pain because there was a medical health professional there to help. On a day-to-day basis, what is it like for you working through with these individuals, especially now that we're seeing the presence of children under the age of 13 coming in? Paint us the picture.
Miss Marshall, first I would just like to say I'm sorry for your loss at this. And now speaking to the question, Wendy, yes, we have a lot of kids at the facility. What we try to do with the kids is to engage the children because we know that being in isolation is an adjustment. So what I would tend to do, I would have some group sessions with the children. I find that sometimes children tend to be, neglected. But the groups, we would find out, how children are coping, how they are feeling as a result of being in isolation, and then just help them to express those emotions. We had a playroom at Harrison's Point, and that was really a hit with the kids because it allowed them to have their own space amidst what was happening around them. Because in that environment, you have parents who are anxious, parents who are afraid, and then it also makes it difficult for the parents then to have to care children. So that's when we stepped in then I realized that, children are somehow being neglected during that time. And we would just try to engage the kids.
So you find out how they are, but in terms of the actual counseling that you give to them, what assurances can you really give them depending on who they're at the facility with, whether it be mommy, daddy, or granny? What assurances do you give them on the ground about how not only their health will be, but also that of the loved one who happens to be at the facility?
In terms of providing assurances, we wouldn't necessarily tell the child that, they're going to leave immediately, everything that they want to happen will occur. Because the number one question always is, when am I going to leave? When can I go home? The kids always say, I want to leave here. So what I try to do is to explain the situation to them. And little do people know, children are very knowledgeable, even down to the small kids. So they do have questions. And I find that, answering those questions for the kids, it really helps them then to become less anxious because at least they have that knowledge and they have that information.
So
So when they
anxiety
ask
is the main emotion?
for kids,
You never
yes,
had any
because
with severe fears or that went into panic attacks or as a result of the fear got an asthma attack or anything of that notion? Or you find children generally tend to weather the storm better mentally?
I would say that children are very resilient. And we see that especially in the smaller kids because as long as they're able to play, then that helps them to adjust. But then with the teenagers now, it's a bit difficult. It's a bit different, I would say. You find with the teenagers, those are the ones who become anxious because they're more aware of the situation, And they're mirroring their parents' behaviors as well. So when the parents are anxious, when the parents are somewhat depressed, you find that those teenagers are modeling that behavior, and they too may tend to feel that way as well. And what I've found too with the teenagers is that some of them, they are already maybe have a diagnosis of anxiety, or they maybe have had experiences of having said panic attacks or anxiety attacks prior to isolation. So then being in isolation only compounds that for them. So that's where I would step in then to help those teenagers to try to cope with the anxiety they're experiencing, and also helping them to manage those difficult emotions that they have.
Okay. If maybe we can have the other two weigh in and how it is generally dealing with those who are resident in isolation and quarantine. Are you hearing me? I was asking you to weigh in on what your experience is with the individuals that you deal with on a daily basis.
Well, I find I used to work at Sunday, and now I work in Queen's College. Those are two different setups. In Sunday, you're not allowed to leave the room. Well, at QC, you're able to move around in the courtyard. So you find that persons at Sunday, they are somewhat more agitated because they're limited in the room. And those at QC, they're more free, yeah. The older persons are the persons that are more concerned about discharge, and in terms of when they do not feel well, they are frightened. Many are being transferred back down to Horizon Point. That is a fear for them. But the younger children, I think the younger children, they are doing very well. But at least at my facility, they're doing well.
Okay, so you said Queen's College is different. So was there any facility there, ORCHID, for them to at least call you on a cell phone, on a landline, to say what they were experiencing in that room, the jitters they were feeling and waiting for results to come back, anything of that nature?
Yes, please. We have walkie-talkies, and we have areas set up where they can actually communicate with us. So we would have on a face shield and mask, and they would speak to us over a barricade.
Okay, and what are the main fears of people in quarantine versus those in isolation? Do they differ?
No. I can't really speak from those in quarantine because I work in isolation. But those fears in isolation would be the same if it is they're going to go home or not. Sometimes you find that persons, they become hypoxic very quickly, and that's when the fear settings. They are very anxious when it is that their saturation drops. They're very concerned about it because, yes, we have a rise of death, and they think that they will become one of them. So that is a fear for them.
If I can speak now to Dr. Douglin and the idea of helping someone through this process when they are still COVID positive but have lost a close family member that they came into a facility with. How is it to help that person cope and try to maintain the balance of their health and not slide further down in terms of succumbing themselves?
So I would first say that we need to really validate how people are feeling in this situation. This is not a normal stressor. This is something none of us have faced before. And we are all grieving. And for persons who are grieving the loss of a loved one, I would say, just validating how they feel. Let them know that it is okay to grieve. And help them to identify exactly what they're feeling so they can begin to process it. Too often we come to people who are grieving with, trying to fix it, trying to offer solutions, and very often what we need to do is be supportive and sit with them and offer a listening ear. So to individuals who themselves are grieving, I would say, sit with how you're feeling. Try to identify exactly how you're feeling. Try to get to know and understand your grief. your experience rather than shut away the emotions you're having. I would say show yourself compassion and recognize that this is a normal human emotion when you experience loss. And I would recommend they be curious about the process. What does this mean to you that you have lost this person? What is the impact of this? And I would say understand that grief is a process. And it's a process that is very individual.
Okay, I want to thank you, Dr. Douglin. We're going to take a break here, and when we come back, we'll talk to Beverly a bit more about having to deal with not only her own situation, but the loss that she experienced thereafter. We'll be back with the People's Business. And we're back with the People's Business, mental health, the COVID impact. To assist me, ORCHID JESSAMY, KADISHA Douglin, FELICIA GILL, and Beverly Marshall. And you can also call us this evening at 228-5562, 228-5563. If you may be still experiencing some COVID stress or trauma because you've lost someone or you yourself have been ill with COVID. Ms. Marshall, when you lost that friend, you'd mentioned that your mom wasn't right there with you immediately after you came out because she stayed a little longer. But when it came now to the loss of your close friend, what did it do to your emotions? And were you at any point seeking to blame anybody for him having contracted it, or were you seeking to blame him for maybe perhaps not wearing his mask enough or complying with all the protocols? What was the process that you went through?
Well, see, like I said, at the time when we contracted COVID, there wasn't really any protocols in place. We was admitted to Paragon on the 20th of March. That was at the very beginning. So, yes, I did blame. I did apportion blame to my cousin that came over from the States. I found her to be very irresponsible for doing that, bearing in mind that my mother is an old lady, and, you know, even the person that picked her up, and that's the person that died, you know your health. There's COVID. And she had a cough. And I can't detract from that. She was ill, and we could see that she was ill. But she put it down to jet lag, but it wasn't jet lag. And, subsequently we got COVID. And I remember the last time I saw him, I could see defeat in his eyes. He was going to the washroom, and as he passed me from the men's hut, he passed the female hut. And I will never forget that. That stays with me. That haunts me. Because that was the last time I saw him. I remember my brother rushing over and saying that we need to come. And I had to get his partner because she was in with us as well. She was in the shower. And when I told her she needs to go and see him, she broke down and cried. Her tears, that scream she gave out, that stays with me also. So the whole experience, and it being new at the time, and even in the UK here, I was on the phone to my sister, and a very, very dear friend of ours died. So at that time, COVID it was just death all around.
How,
And
since
it
you've
left, it just
experienced
damaged me.
Since you've experienced all of that trauma and that damage, have you gone to seek a health professional? Have you been doing continuous visits? Is there anybody for you to reach out to? Have you found solace in
That's
God?
what I said.
Yeah.
There was a I'm going to call Dr. Graphic Drummond. I remember getting on the phone to her and crying because I'm my mum's main carer, and to lie in a cot looking at my mother curled up next to me with this virus that we don't know if it's going to kill us or not, because that was the reality. That was our reality. And I didn't cope very well. I didn't cope well. And I remember speaking to a doctor that came to do our vitals that night, and I had tears in my eyes, and she said to me, "Do you need to speak to someone?" And I just said yes. And then the very next day, Dr. Graphic Drummond phoned me, and she stayed with me for at least 6 months into the year. After my mum came out, she supported me. She gave me whatever medication I needed to help me sleep. She was able to talk to me. I had the support of my sisters in the UK and my family in the UK. But, you know, they got me through it. Reach out to family, friends, anyone that will offer you time to listen. Talk to them. Talk. You need to talk. And if you need, and there's no shame in saying that you're depressed or that you're anxious or you have anxiety or that you can't sleep. There's help out there. Take it. We need to recognize that there is mental health issues. And I knew that without Dr. Drummond, I would not have made it through. There are many a night I cried on the phone to her, and she was always available. She brought my medication to me. She made sure that I was okay. And I believe that got me through. That, with the support of and the love of my family, that's what got me through.
Okay. If I can have Dr. Douglin and Miss Gill weigh in here now. She spoke to the idea of blaming someone and not being able to let go of it. How dangerous can something like that be, especially if you have a large family unit and the whole process of healing has to come about firstly? And then secondly, she also spoke to the fact that there's nothing wrong with reaching out to somebody and admitting that you're not coping well. Are people in isolation actually reaching out, or are they bottling up all that they feel as a result of what the illness is doing to their psyche?
Yeah, well, I could speak to the first part of your question, and I guess, Felicia, you can speak to what's happening in isolation. I would say anger and blaming is actually recognized as one of the stages of grief. People go through feeling denial, anger, they begin to bargain, they become depressed, and they eventually come to a stage of acceptance of what has happened. And so I would say that her experience there is quite normal. What I would say is, as I mentioned before, trying to understand what you're feeling and understand what you're experiencing, and try to process it. So recognizing, is this blaming helpful in me being able to process and get to a stage of acceptance? And that's something very individual and something she can definitely work through, and anyone can, with their therapist. But I want to again validate and recognize that these are normal reactions when there is loss.
Okay.
And Felicia, you can speak to what is happening in isolation with persons reaching out, but definitely I agree with Miss Marshall. Don't be ashamed of what you're experiencing. Very often in our culture, we bottle up emotions. Any emotion that is difficult, we try to turn away from. And we really need to feel all of our feelings and recognize when we're not functioning the way we should and seek help. We shouldn't wait till it's a disorder, really. We should be recognizing, I'm not quite feeling right. My sleep is getting a bit off. I'm noticing I'm more irritable. Maybe I should reach out and seek some help.
Okay, Felicia?
And just to add to that too, I would say that I find a lot of persons, they have been engaging in self-blame as well. So it's not only blaming others, but they've been blaming themselves for being the reason the person has become infected, because in their minds, that's what happened. So try to work with the patient. And again, as my colleague said, normalize the behavior. But of fact, when you ask the patient if they want to speak to the psychologist, some persons decline. And again, it speaks to the stigma of mental illness and also towards the mental health fraternity as well. But when I go in, I never approach patients to tell them that, they've been referred to me. I always go in on a daily basis just to check in with patients to see how they're coping and to see how they're doing. And a lot of patients respond. I find that I have to do a lot of empathetic listening. So especially those persons who are grieving the loss of a loved one as a result of COVID. They want to talk about it. Out of listening to what the patients have to say, I find that the patients then they speak about the memories that they do have with the loved one. And I always try to encourage the positive thoughts, encourage the positive behaviors while they're in isolation.
Okay.
And also,
What I want to find out here before we get ready to go to break again and remind our callers that you can call us on 228-5562 and 228-5563. When we're coming down to those final moments where you know that the person you came into isolation with isn't going to make it, how much or how far can you go in terms of ensuring that that person gets to say the final goodbye? Is it always a situation where that is possible at the facility, or maybe sometimes might it be a really sudden and drastic change and therefore there's not enough time to get that person who might be in secondary or tertiary over to the person in primary?
the change oftentimes is not that sudden. We try to facilitate the family members, maybe just the closest family member, and we have them go into the primary facility to be with the loved one, just to spend a few minutes with them. Something if they are at the Harrison's Point facility, but it becomes a bit more challenging if the family member is at one of our external facilities. But what I would say, because we do understand how difficult it is for patients to know that your loved one is with you in tertiary just a couple of days ago, and then their condition changed, and now they're in primary, and maybe they're critically ill. And for anyone, that would be terrible news. So we really do try to accommodate the family member so that they can go and spend that time with their loved ones.
Okay, well, I'm happy to know that there's a level of accommodation. Is it the same where you are, ORCHID? If a patient has to leave Queen's College and go to Harrison's Point, do you all allow that accommodation to be made so the family members can say their last, can speak to each other to, give the reassurance that you're going to pull through, I'm rooting for you, I'm praying for you?
Honestly, most of the time that is not facilitated. Minors would have to go with their parents, but when you have two adults, you can't facilitate it mostly. The most they can do is speak to each other before they get on the ambulance and go back to Harrison's Point.
Okay, understood. So there's that slight emotional disconnect there.
Yes.
Okay, and if the person expresses anxiety to you thereafter, do you then make the referral to a psychologist for them?
Yes, we try to do that.
Okay, in as much as you possibly can. Okay, our call number is 228-5562, 228-5563. I want to get back to Beverly a bit. Okay, we're going to go to commercial break, and when we come back, I'll speak to Miss Marshall about whether or not she's interacted with any other COVID sufferers. We'll be back in a bit. We're back with the People's Business, 228-5562, 228-5563. If you have any questions for our panel in terms of how you're coping with your mental situation as a result of COVID-19. If I can go to our COVID-19 survivor, Ms. Marshall. Since you have returned to the UK, have you encountered any other friends or family members there who did also come down with COVID? And what has your advice been to them?
They take COVID, they approach COVID very differently over here. They tend to self-test themselves, and if they test positive, they will stay at home. But by and large, people just get on. So to say that it's not as, I think that phase of when it was scary has long passed, and now they're just getting used to living with COVID. Kids are at school. I had a friend tell me the other day that her son came home from university and he gave her COVID and she's at home. So they speak about it very openly. It's more like catching a cold now. Oh, I've got COVID, I'll stay home, then I go back out again. So it is different over here than when we first had it in the UK, in Barbados.
So even with the variants, there really isn't a scare? Everybody is just like, this is the new way of life, I'm coping?
Yeah, basically it's your responsibility. You should know if you're sick, stay home. And I think, even I was saying to a friend of mine in Barbados, we need to adapt our attitude in Barbados. Be responsible. You know that you're feeling unwell. Stay home. Take the test, and if it's positive, you know what to do. Isolate 5 days. Then you go back to work. They don't even need a negative to go back to work. They just go back to work. Most of the UK is open back up and it's business as usual. Schools are open, the kids are in school full time and people are back at work and just getting on. And it's a case of living with COVID. I watched the London Marathon this morning and I didn't see a mask in sight. But then in saying that, the vaccinated rate in the UK is over 80%.
Okay.
So I don't know if that is, that has a bearing on what's happening as well, because it is a very good vaccination rate. That's people with both the first and second jabs.
Okay, so I guess they might be seeing their herd immunity as a protectionist mechanism. Yeah, but
don't get me wrong, there are still cases and people are still dying. But it's not talked about as much. It's not dominating the news. And like I said, people are just getting on with it. If you're feeling unwell, you choose to wear your mask or you don't. If you're vulnerable, you take the necessary precautions. But people are walking around without masks, without social distancing. I had to tell a man in the supermarket the other day, can you not stand so close to me? Because I felt I could feel him within my safe space. But they're just getting on with it.
So
and I think that is going to be going forward.
Okay, but Do you see that as a level of confidence and being willing to progress beyond? Or do you see that as a level of complacency whereby it's like, okay, we have the shot, so we don't have to bother about all the other protocols in as much?
I think it's a case of acceptance. I think over here now, it's a case of COVID is here, it's not going anywhere. We can't keep everyone in a bubble, so we're putting the responsibility back to the individual. You know, like I said, you know if you're feeling unwell. Every time you go out, you come home, you go through the protocol, you wash your hands, you wear your mask. I still wear a mask when I go out. As soon as I come in, I wash my hands, take off my clothes. And that is because my sister that I'm staying with, she has lupus. So I've got to protect her. And it's for me, because I've had COVID, I know what COVID can do. I've lost friends over here to COVID, and it's more personal over here because it's not just hearing, it's people that my age that I've grown up with that are no longer here because they go into hospital, they're on a respirator, next minute they've gone, COVID. So it is real. I'm not trying to blanket it off and saying that COVID doesn't exist in the UK. By all means, it still does, and it's still out there. But that fear and that stigma that was there last year is no longer, I don't feel it as great as it was. Compared, when I make the comparison with here in Barbados, it's two different worlds. It is.
Okay. Felicia, how do you find it? I don't know if maybe perhaps you would have dealt with any non-Barbadian people who were resident in isolation versus locals. Have you had to deal with any situations like that?
Yes, maybe a few months or so ago, where we had quite a number of tourists and a lot of non-nationals on the island. We had them admitted to the facility, and what I found made it a little bit difficult because coming from your country where the protocol was a bit relaxed, maybe mask wearing was not mandatory, and then coming where we have strict protocols in place, masks is mandatory, social distancing is required, and even with our isolation protocol, where we have a 10 to 14-day period for isolation. Whereas in other countries, the protocol may be a bit different. What I found is that it made it quite difficult for some of those patients to adjust to our protocols and also to isolation, to our protocols in isolation.
What was the general reaction that they showed? Was it a level of anger and vexation, or was it depression because they weren't able to carry out the holiday in the way they wanted to?
I would say it was a mixture. There was a lot of and frustration as well as annoyance. And then there were those who were anxious and who displayed some symptoms of depression as well. And then there were others who were a bit and they understood that, our country, so it's a matter of following our protocols and doing what needs to be done. But for those persons who would have been displaying anger and frustration, it was understandable because a lot of persons came here maybe for a celebration, maybe for a wedding anniversary, to attend a wedding, or maybe it was even something like to attend a loved one's funeral. And we could understand that. And there were some persons who, as a result of isolated, were unable to attend these events. And I mean, that was a bit disheartening for them. And we also, it was disheartening for us as well. But it was the protocol, and in order to do what we needed to do to protect our country, those persons would remain in isolation, despite the feelings.
Okay. Now, in terms of knowing that someone is here for a funeral, and when they come in, they end up testing positive and have to be in isolation, how much effort is made in terms of maybe perhaps allowing them to be able to log into that funeral service if it is being Zoomed, etc., to help them, basically walk that bridge to that closure which they need. Because for a lot of people, they can't come to grips with the person dying unless they're actually physically there to see them in that box.
We try to facilitate persons as much as we can. We have in-service, so persons are able to log into Zoom sessions. They are able to contact family members, even to assist with planning, things like that. So we do not hinder persons in that regard. But in terms of discharging persons to attend the funeral, that's something that's beyond us, something that we would not be able to facilitate. What we may do, depending on the time that persons are in isolation, they may be retested to determine to see if they're still positive or if they would have a negative result.
Okay. Now, if I may speak with Dr. Douglin now, Dr. KADISHA Douglin, who is a member of the Barbados Association of Psychiatrists. When you look at how COVID is impacting now and the fact that numbers are going up each day, what is the fear generally overall in the profession that we might have people perhaps that may want to go the road of, heaven forbid, suicide because they're blaming themselves for the death of someone, whether it be an elderly member or whether it be a spouse, partner, friend, what have you?
Yeah. So from the beginning of the pandemic, there was a concern amongst psychiatrists, mental health professionals worldwide that we would have a subsequent pandemic of mental distress and deaths of despair or suicides as a result of despair because of loss, and loss not just of loved ones, but loss of livelihood, loss of financial security. So far, internationally, the data has not suggested that we've had a significant spike in suicides. But anecdotally on the ground, my colleagues at the psychiatric hospital have been seeing more people presenting in distress, emotional distress, people who are depressed, who are dealing with anxiety, and also dealing with acute psychotic episodes for the first time because of the stress of what they're dealing with. And so having this mental health fallout, and we're already beginning to see it, is a real concern in the profession. And I think it's important to, maybe I'm getting ahead, but to say to everyone out there, and I said it before, if you're noticing any changes within yourself, you're noticing you have intense distressing emotions that are persisting day after day. You notice changes in your sleep. You notice your appetite is changing. You notice you are feeling fatigued. You don't have any energy. You have brain fog. You can't concentrate. You're not functioning the way you used to. Seek help early. Don't wait until you're beginning to feel hopeless and despairing and beginning to have suicidal thoughts. Don't wait. Seek help as soon as you notice changes.
Well, we're going to commercial break now. When we return, we'll discuss how it's impacting our children a bit more. The People's Business. We'll be right back. We're back with the People's Business, and we're looking at mental health, the COVID impact. I wish to specifically look at our children because the numbers are day on, day in going up in terms of the under 13s who are coming down with the virus. And Orchid, I want to find out from you in terms of helping these children to cope at the center and looking at their behaviors. Is it any different to how children might be ordinarily in a setting that they're not accustomed to? Or do you find that they're more either hyperactive or crying and more irritable?
No, I find initially when they come into the center, they are a bit reserved. Yes, it's a no environment for them, but we have a little play area where they can collect toys, and then there are other children there. So eventually they get accustomed to the surroundings and they're okay. You find the older children, the teenagers, they are the ones that are attached to the devices. So if the Wi-Fi is down, that's a problem for them. But when it comes to the smaller children, they are fairly okay.
But they aren't aggressive or any of those things, because we would have heard about some fights and so on at some of the facilities because people are a bit tense, but it doesn't get to the childhood population.
No, please. Not all I have experienced. Not absolutely, no.
Okay, and what about you, Felicia? Are your children responsive in the same ways?
Yes, the children are quite resilient, especially those small ones. As long as they have their toys, they're able to run around and play. One of the main things is that children, they make friends with it easily. So you find that children, they befriend each other and they actually help each other to adjust. So you don't have many problems with the kids.
Okay, well, that's good to know. Now, let's go back to the idea of first being there. Do we see a large body of general withdrawal, especially at the centers which are now housed at the schools, whereby the idea of privacy is not what you're accustomed to having when you're at home? Do you find the individuals generally, and this is directed to Orchid and Felicia, do you find that the individuals when they come in are not their usual selves, or they take quite a bit of time to warm up to the not only the health professionals but also the other people within the facility?
I find not usually, because most of the time we try to place the families together. If you have a single person, like we will try to put them in a room with the same sex and within their age range. So most of the time they're okay. There are some people, yes, that prefer to be alone, and you will have to speak to those people separately. But most people seem to cope really okay in the dormitory setting.
Okay, and what about you, Felicia?
I have had quite a different experience. So for some of the patients, it becomes for them, especially those who value their privacy, who are not accustomed to sharing accommodations, sharing spaces, sharing restrooms. It becomes a bit difficult for them. And those are the ones that I really try to reach out to, because they experience symptoms of anxiety, and you find that they do tend to withdraw. But a lot of it has to do with a lack of information, because one of the myths is that, you know, if a person has been isolated, let's say they only have 2 more days remaining in isolation, and some person is newly admitted to the facility, the belief is that that newly admitted person can make the person who only has a few days left, it can cause them to become ill, cause them to have to remain in isolation a bit. But then I find that, you know, as long as the patients, they have that knowledge and then that, you know, that's not the case, people then become to be less anxious, and they then don't have many issues. But I find that not having that information is what creates the anxiety for patients.
Okay, so lack of information is what weighs in on some of these individuals. Okay, well, we're giving it to them tonight. This is the People's Business, 228-5562, 228-5563. Now, If I have, let's look at the person who does not have the illness, but there's someone in the family who does. But because they might have moved from quarantine to isolation, and we're not fully aware of all that's going on in that transition setting, we too, as individuals, get anxious. So what would be your advice, Dr. Douglin, to help someone, say like myself, who, if I had family members that were impacted and affected but could not locate them or know exactly what was going on, and I'm hyperventilating and the whole lot of it, what would be your advice to me to ensure that I don't take myself beyond the brink in worrying about this person and the illness?
Yeah. So, first I would say try to reach out to your other close family members who may be able to give you some information, give you some reassurance. In terms of those heightened emotions, regulating your emotions, finding healthy ways of coping, like doing some breathing exercises, getting out in nature and getting some fresh air, again, connecting with people you love and trust who can listen to you, limiting the bad news that is bombarding you so that you're not thinking of the worst case scenario happening to your loved one who is ill. Doing some movement, exercise, a quick burst of exercise can actually be quite calming. And do things that can soothe you. Soothing music, your favorite tea, something calming to relax you when you have those heightened emotions.
But maybe it was that person who used to be my relaxant.
So I think definitely, as Felicia said, getting information, when you don't have all the information and there's a lot of uncertainty, it is quite normal to be anxious when you don't know. And if you can find out what you can from other relatives, that would be a help. And if that person who is now ill, you can't speak to them, are there other people in your social group? Or seek the help of a professional. You can seek the help of, at the psychiatric hospital, the assessment unit. You can seek the help of your polyclinic. There are mental health clinics at each polyclinic. So if you don't have people around you you can reach out to, you can reach out to a professional.
Okay, Beverly mentioned something about medication and it helping her to overcome. Now, there's some people who may not wish to take anything to help calm their anxiety, may not wish to take anything to help them sleep, for fear of the same stigma which we spoke about earlier. We think that it might be something that is continuous, or that we might become dependent on this drug to get us over that hurdle each and every time.
So when it comes to emotional distress, there are some individuals who have distress but may not have a diagnosable disorder and can benefit from talk therapy, from meditation, from relaxation techniques. Okay. And then there are others who have more severe symptoms who meet the criteria for a disorder and may require additional assistance in the form of medication. And what I would say is there are different types of medication, and having that open discussion with your doctor can again provide you with some information about the use of medication, the duration of time you may need it, and how it can help you get back to a state of functioning. And so just as you would take medication for hypertension or diabetes, if you have severe psychological symptoms that would benefit from medication, that would help you get back to functioning and good health, then why not take those as well?
Okay, we have a caller on the line. Good evening to you.
Hi, good evening. You would have mentioned before that the younger children playing comfort in playing with each other. I'm just wondering, like, how does that happen in the isolation facility? Like, are they allowed to be close to each other? If there's a child that comes in earlier than another child that is probably like on their way out, and a newer child that comes in contact, like, how do you separate the children from, or is there separation, or is there no need for separation?
Okay, did you hear the question, ladies?
Yes.
Okay, she asked, in the event of children and there being the contact to play with each other, if there's not ultimately a separation of the children in terms of what stage they come into the facility at, or if you allow all of them to be close to each other. How is it that they come to play, and if there are any fears and concerns about them being close to each other?
I can answer this question.
Sure, go on, Felicia.
Right, so as I alluded to earlier, that's the misconception of many persons. So as long as persons don't have the information, so where you have a child who might have been in isolation for 10 days, and then you have another child who's newly admitted on their second day, that child, becoming in contact with the who would have been there for 10 days, that child can in no way affect the other child's prognosis or their condition. What we always say is that COVID is COVID, and as long as you've tested positive, it's not a case where a newly admitted person, if they're coughing and stuff, that can in no way affect your prognosis, and it will in no way delay you from being discharged the date that you were informed of initially.
Okay, I want to thank you for that answer. And we're going to go to break. And when we come back, we'll talk more about mental health and the impact which COVID-19 is having. And we're back with the People's Business. Before we went off, Dr. Douglin was speaking about the fact that there is community mental health nursing at all of the polyclinics, and that there's also a clinic type at the psychiatric. However, there's some people who maybe perhaps may not go to those places. It might not be within their time scheduling. What other options do we have, Dr. Douglin, in terms of being able to seek that assistance and that support for whatever mental issues we might be grappling with as a result of COVID?
Okay. So in terms of private resources available, for psychological counseling, the Barbados Society of Psychologists has their directory available on their Facebook page. so you can see the list of members and seek help. Through workplaces, there's network services, and I believe through the government you can have, I believe, 3 sessions with network services. Through your family physician. So family practitioners are the first point of care, including for mental illness. And so if you are struggling, you can see your GP, and your GP can refer you to either a private psychiatrist or a private psychologist, or if need be, refer you to the psychiatric hospital or to the mental health services at the Queen Elizabeth Hospital. So those are options available via the private route.
At what point do we move from the psychologist to the psychiatrist?
So a psychiatrist is a medical doctor who has then gone on to specialize in mental health, in the diagnosing of mental illness, and the provision of pharmacotherapy or medication therapy, as well as talk therapy. And the psychologist has done a first degree in psychology, as well as a master's or PhD in psychology, and they provide talk therapy. They also do psychological assessments and so on. So in terms of transitioning from one to the other, it really depends on the stressor you're facing and the symptoms you're having. For some people, mild distress, they really just need talk therapy and supportive therapy, certain types of psychotherapy, and they can obtain that with a psychologist. Persons who have moderate to severe symptoms of depression and anxiety may need additional help. That is, seeing a psychiatrist who can determine, is this a disorder that requires further treatment? And then that psychiatrist will be able to prescribe medication in addition to talk therapy.
Okay. Now,
well, that answers that question.
Yes. There are also some other resources that we have listed here. The Business and Professional Women's Crisis Center. There's also Advocates Against Domestic Abuse. The Government's Helpline, a hotline for Muslim women. There's the Men's Empowerment Network. There's online counseling, the psychiatric hospital, as was mentioned. The police are also listed, along with Seroptimus International of Barbados, Women of Purpose, and the QEH's 24-hour hotline. So those are all places that you can reach out to, even the Child Care Board in the case of your children, if the anxiety concerns continue thereafter. So there are a number of avenues for you to reach out to. Now, let's look at it again. Are people willing to reach out? And what about in your instance, Felicia, when cases are assigned to you because certain things are seen in their behaviors at the center, either the refusal to eat, the refusal to perhaps maybe want to take their personal hygiene, whatever, into account because they are just so thrown by having contracted this illness, or the people around them all having it, especially like, say, for example, maybe I'm the matriarch of the household or the patriarch, and no, because I got it at work, I brought it to my children, I brought it to my elderly mom, and we're all in isolation at that point. What do you do, or what can you do with some person who's not talking, who's not doing what's the normal routine, who generally isn't coping? What can we do?
With persons who may be a bit resistant towards the process and who may refuse psychological service, when I approach them, if that's the case, something as simple as just sitting with that person, just being with them in that moment of their frustration, or maybe being with them in that moment of their sadness, because some of the symptoms that we see, some persons may have sleep disturbances. So they have difficulty falling asleep, or they may have difficulty staying asleep. There are some persons who maybe may have a change in their appetite. Maybe they now have an increased appetite and they find comfort in their food. Or there may be persons who have a reduced appetite. So I just really sit with those persons for that moment. And then I find that as long as persons see that you are genuine and you genuinely care about, their well-being, they tend to open up. I find that for us as Barbadians and as a society that we now are coming around to mental health and seeing the importance of mental wellness. So I find that a lot of the patients, even if they are resistant initially, I find that they become open, and as soon as rapport is built or when a relationship is built, they just talk. A lot of the times they want some person who's there to listen, some who's empathetic and understanding of their situation, and just for them to adjust in that moment. Because most of the time we have to consider the fact that persons don't just develop anxiety while in isolation. Maybe before they came into isolation, maybe they were laid off from work. Maybe they were having financial difficulties. Maybe they were afraid as a result of the increasing number of persons who were contracting COVID. And even just the fear of uncertainty as to, what's going to happen to me now that I'm here in isolation. So all of these things consider, knowing that patients, they come already with things happening, and then being in isolation may only compound that for them.
Okay, if I can just get back to Beverly here quickly in terms of the changes that you've made and how you are coping. Would you say that you have gotten over your emotional and mental distress fully, or do you think you're maybe at least 50% of the way clear?
For the best part, I think I'm over my COVID experience. I have forgiven my cousin. I think forgiving her was a big part of moving on, because it took me a long time, a very long time, to actually forgive her. But other than that, yeah, once my mum's home, my brother came home, my auntie came home, and we all started to get back into normal, whatever normal is now. Yeah, I'm good. I'm good.
Okay, and you are still, as you said, taking all the precautions that you need to take.
Yeah, I'm more. Yeah, like I said, I was in a shop yesterday, Friday, and this gentleman, every time I stepped forward in the queue, he was right behind me, and I put up with it for about 3 paces. Then I had to turn around and say, "You're too close. You're just too close." So I still wear a mask when I go out, sanitize, change your clothes when you come home, and follow the same protocols we follow back home. It's hard. It's been ingrained in me. I can't change it now.
Right, so it's the protocols and not fear that's causing you to continue this practice.
Yeah, I think it's not necessarily fear, or it's respecting the other person. I know that COVID exists because I had it. So, and I know what it can do because I saw it. So when you've got people around you that are vulnerable, you take whatever precautions you need to take to protect them. And that's what we all need to do. We need to protect each other as well as ourselves.
Okay. If I could speak back now to the medical individuals on the panel and look at the issue of the vaccine. For those who have had some mental challenges while at the facility but were unvaccinated, how did the vaccine ever weigh in terms of your conversation with them? Did they say to you anything about it putting them in a worse, fear position? Did it ever come up?
It often comes up, if I might add. One of the main questions a lot of persons ask, especially those who are about to be discharged, they ask, how soon can I get the vaccine? Can I get it even though I've had COVID? So that's one of the main questions I find those patients who, upon discharge, they ask about the vaccine.
Okay. Has that happened with you as well, Orchid? Are they inquiring about it?
They do ask, yes, please.
Okay, and what's the advice in terms of the timing, or is it just for them, or is it to protect them, or do they say they want to ensure that they protect their loved ones more and don't end back up in the same situation?
It's both. It's both.
Okay, I'm not sure if where you are, Kadisha, if you would be a vaccine advocate as well, or if you just allow people to make their own decision.
Yes, I do promote vaccination, but I also do respect people's choice and decisions. But what I try to do, and I think most of my colleagues try to do, is give people all the facts, point out the risks, and hope that they can make an informed decision based on all of the information that we've given them. While, you know, showing them respect and showing them unconditional regard.
Okay, what about something like the fear of the needle? Because for some people, that's one of the main things that's a block for them. They admit, yes, it's going to help, but having this thing come up to your arm is what drives fear deeper into that.
Yeah. So, and you know, there's fear of the needle, and then there is actual phobia, which is much more severe. So in terms of someone who is just fearful, there are things that the individual administering the vaccine can try to do. Really try to talk with them, try to engage them in conversation about themselves, you know, as a bit of a distraction. They can go in trying to engage in some relaxation techniques, focusing on their breath, counting their breaths, or focusing on a pleasant memory or a relaxing place. And if it is more severe, if we're talking about a phobia, then there is therapy available that can help them to get to the point where they're able to have an injection.
Okay, I want to thank you for that. We will be back with the People's Business right after this break. Before we went off, we were talking about the vaccination and how that plays on the mental health of some individuals. Now, Dr. Douglin mentioned something, and she spoke to phobias. And I'm just wondering, in terms of the actual facilities, and each of you could weigh in on this individually, whether or not you've seen phobias from individuals, either people afraid to shower in an enclosure that's underneath a particular size, having to share space with strangers, having to interact with strangers, having to eat meals from people that they're not accustomed eating from or with. Have you seen those sorts of nervous things come about? Have we seen people who are already diagnosed with OCD, who may have contracted COVID-19, finding it difficult to get through this process and those days in isolation? Felicia?
That is something that that I've been seeing. There are persons who have social anxiety, persons who may have fear of sharing spaces or even a small space. And we have had persons who would have had OCD admitted to the facility. So what we do is we try to accommodate these persons as best as we could. So those persons with the phobia of, being in a shared space, we usually try to accommodate those persons by maybe transferring them to the hotel. That way they would have a smaller space, and the number of persons within that space would be very limited. We also offer to patients of private isolation, and that is one that some persons do consider. Also, too, as I said, would be social anxiety, some persons who may have OCD, and that's mainly what we see.
Okay. Beverly, I saw you laughing a bit at the question. Did you have any spatial anxieties?
No. No, my sister's wondering when we're going to go to bed. It's 3:30.
Oh, yes.
So I just started.
Okay. Well, I want to thank you for staying up past your bedtime, because I'm sure a number of people who would have encountered the virus since yourself have actually gained some inspiration, some motivation, and some understanding of how to cope. Well, it's time now for our final takeaways from our panelists. And for my first takeaway, I will go to ORCHID JESSAMY. If you had to talk to individuals coming to isolation about how to cope mentally, what would be the one thing you'd tell them?
I would tell them to keep an open perspective. That's the honest to God truth. Because you come into a situation that you're unaware of, there are other things that you might not be aware of. The most problem that persons have is the uncertainty. They're away from home, they're away from their comfort. So you need to have an open mind. If you have any issues, you can always talk to the staff. We are always here to try our best to accommodate you.
Okay. And Beverly, so you can get off to bed, what's your takeaway on the mental health impact on persons with COVID-19?
There's no stigma, there's no shame, there's no blame. It happens. You catch a cold, you take the treatment, and with the grace of the dear Lord, you'll get through it and you come out the other end. If you need help, take it. Talk. Don't bottle it up inside. There's no, like I keep saying, there is no shame in having COVID. Take that stigma away and just deal with it as it is. It's a virus that we can all get over. And some of us don't, but most of us will.
Okay. Felicia?
I would just add to what ORCHID stated in terms of having an open mind when you come to the facility. And you're also free to bring any familiar to you. With children, if you have a special toy or book, you can walk with those things. With the adults, you walk with your laptop or walk with something that's familiar to you. So at least that it would create some sense of normalcy for you while you are in the facility. And I just want to add and say that in terms of with this pandemic, the effects, the mental health effects, they usually outlast the physical effects. So I just want that for us as a community and for us as a country to see the importance, of having services, psychological services, psychiatric services in place for persons who have experienced COVID-19 and who have experienced loss as a result of COVID-19.
Okay. And the final word goes to you, Dr. DOUGLIN.
Yes. So I just want to remind everyone that this is not a normal stressor we are facing. And it really is okay to not be okay. We are all grieving. whether it's the loss of a loved one or the loss of our jobs or, just financial security. We are all grieving, and it's okay to reach out and seek help, talk to a friend, talk to a pastor, seek professional help. It's okay. And I think we all need to recognize we are all in this, and we are all working through this, and we can support each other, and we can reach out for help.
Okay, so there you have it. There's help available. Reach out and get it. Just be sure that you understand that COVID is something which can affect, impact all of us. We've been dealing with mental health, the COVID-19 impact. Our guest, ORCHID JESSAMY, a registered nurse at the Queen's College Isolation Center. Dr. KADISHA DOUGLIN, a member of the Barbados Association of Psychiatrists. FELICIA GILL, an isolation facilities clinical psychologist, and Beverley Marshall, a COVID-19 survivor who's joined us with the UK and stayed up way past her bedtime. I want to thank all of you ladies for joining us here. I want to thank our callers. I want to thank our crew. Everybody do have a good night. It's been The People's Business. I'm Wendy Burke.